live. Okay, hello everybody. It's Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And this is the time I get to spend with you guys and of course go over plastic surgery topics and answer all your questions. Okay, so today we're going to go over something that I've been doing since 2019, but it's still a hot topic, but I've been doing that since 2019, which is the ultrasound guided BBL. The safest way I would say to do a BBL, and in my opinion, I think that everyone should be doing a BBL in this way. But the other reason I want to talk about it today, because I don't know if some of you guys were on for last Wednesday, I was talking about the Vaser, and so the Vaser uses ultrasound energy, okay, and this here is ultrasound imaging. And so I wanted to do these back to back because sometimes there's confusion right out there, because people, they'll say like, oh hey doc, you're now using the Vaser, but I thought you said you were using ultrasound since 2019. And that is correct, but it's two different things, right? So the Vaser uses ultrasound energy, okay, and this machine here uses ultrasound imaging. So this is to see an image, okay? So I wanted to bring it along here today, and you can see what the great thing about the ultrasound that we use for the imaging is that it's very, very small. Look how small it is. It fits in my hand, and that's why I'm able to hold this with one hand and inject the fat with the other, okay? So I've been developing this technique for, 2019 to 2023, 4 years now or so. 2024, excuse me, yeah, probably 4 to 5 years. And so now I have it down pat. I use the ultrasound on the one hand, I have the syringe on the other, and I just do it all myself. There's no need for any sort of tech or anyone else. Like I said, everything I do it just myself. No need for any help. Okay, so I wanted to show you guys what the machine looked like, which is very, very small here, and what it does is that it projects the image to an iPad. Okay, so obviously you need gel, and when we're in the OR, there's a sterile gel that we can use, and then we put the ultrasound over the tissue, and it projects an image here. So right now, I'm just putting it over my wrist. So these are like the internal tissues of my wrist, okay? But of course, when I'm doing ultrasound guided BBL, I put it over the buttock area, over the gluteal muscle, so I can see all the layers of the buttock. But you can see that image there, and as I move it around, the image moves around, okay? So the image is being transmitted from this device in a wireless fashion to the iPad, which is great because that means that it's very, very portable. So I can take it from one OR to the other. We have 3 ORs here at Pure Plastic Surgery. So I can take it from one OR to the other very, very easily. If I need to do a demonstration, I can take it to a meeting. I can show people how to use it. It's very, very, very easy to maneuver and move around. Okay, so there you go. So you see the image there. Now, of course, to most people, that image just looks like a whole bunch of whites and gray and black lines, right? And that's of course where the training comes in and the experience come in, okay? You want to be using this, you got to know exactly what you're looking at, okay? And of course the wrist looks very different than a buttock, okay? And that's why we have our trainings here at Pure Plastic Surgery, where we have surgeons coming from all over the US and all over the world, okay, to train how to do this for the BBL. And when we do the training, we have a patient there, and they can watch me do it live. Okay, so I'm actually doing it in front of them, and they can see how I do it live. Okay, and it's really the best training there. It involves, of course, a talk that I give beforehand. It involves some video. It involves the live training, and then we come out, once the case is done, we come out here to the clinic area, and then I let them use it on some models that I can put right on the desktop table there that kind of mimic the buttock, and they can use it there and kind of play with it in the cannulas and start using it, start getting used to it, so they can then go back home, get the ultrasound, get their iPad, and start doing the ultrasound guided BBL. Okay? Alright, so I think you kind of get what it is. Small device, easy, portable. Image is in the iPad. I can move it anywhere I want. Okay? So, what does it kind of look like? Unfortunately, I don't think Instagram or TikTok or YouTube will let me put someone's live butt on here. I think that'll be frowned upon. So I don't have a live butt, but I'm gonna draw it out for you in terms of what the layers look like. Okay, so as you can see, the image it's basically a kind of rectangular image there. And so what you're going to see there is first you're going to see the skin, okay? And then underneath the skin, there's going to be fat. We call that the subcutaneous fat. And there's actually 2 layers of subcutaneous fat. Okay? So there's 2 layers of subcutaneous fat, and then underneath that is who's going to take the wild guess? The muscle. That's right. The gluteal muscle. Okay? So you got the skin. That's going to be what you're going to see on top. And that's actually going to be like a fairly white line. And then you're going to see this kind of line there dividing the 2 layers of the fat. This is what's called the scarpa fascia. And that's going to divide the superficial fat layer from the deeper subcutaneous fat layer. Okay? So the superficial subcutaneous fat layer from the deeper subcutaneous fat layer. Okay? And then on the ultrasound, this is actually portrayed as a very thick white line. That is the fascia overlying the gluteal muscle. Okay? And that white line is always there. And ultrasound is so great because now we're turning a blind procedure where we're just going blindly just by feel and experience. Now we can actually see. So you're turning a blind procedure into one where you can actually see. And now you can see exactly where your cannula is, and that you can make sure that that cannula is in the right space before you inject the fat. And when you start, you want to start by placing the fat in that deeper subcutaneous place. Okay? Why? Because think about it. How would you build a mountain? Would you build it from the top down or from the bottom up? Bottom up, right? So you want to start by putting the fat in that deeper subcutaneous place. So you want to be just deep enough, but not too deep that you're in a danger zone. Alright, so you're putting that fat in that deeper subcutaneous space and you're starting to build that mountain, you're starting to build that projection, giving the buttock more volume. And once you're done filling that deeper subcutaneous space, then is when you start to fill some of that more superficial subcutaneous space to kind of finish off the peak of the mountain, if you will. Alright, so I hope that makes sense. But what you never want to do is inject fat into here. Okay? So say, for example, you place the cannula, you use the ultrasound and you see that the cannula is beneath the fascia into the muscle, then of course you're not going to inject any fat. You're just going to pull out the cannula and you're going to redirect the cannula and you're going to make sure that's in that safe space above the muscle fascia. Alright? So just a little reminder, why is this so important? Because in the muscles where you have the large vessels, they're called the superior and inferior gluteal vessels, okay? Mainly the veins are the culprit, okay? And these veins are actually rather large and they connect directly to the big veins that then go to the heart and the lungs, okay? So if you were to be doing this procedure blind and not know where you were, okay, and you put that cannula into the muscle and you hurt, basically you hurt this big vein, so the cannula kind of goes through there and it hurts the big vein, and then you inject this big glob of fat into the area, the fat's going to go inside the vein. That fat's going to go inside the vein. From there, it's going to travel to the lungs, and it's going to cause what's called a pulmonary fat embolism. Okay, P-F-E. Pulmonary fat embolism, which is different than a pulmonary embolism. I know medicine can be so confusing. They're not the same thing. There's a pulmonary fat embolism. Okay, and when you have a pulmonary fat embolism, it can be fatal. And it can be fatal instantly. Okay? Alright. And that's why back in the day, and by back in the day I mean before 2017, the mortality rate for the BBL was too high. So initially the mortality rate was, let's see, everybody got this? Yeah?
Yep.
Okay. So I'm going to erase this a little bit then, okay? Alright, so back in 2017, the mortality rate for the BBL was 1 in 3,000. It was way too high and the highest of any cosmetic procedure, but this was back in 2017. Okay, Since then, there's been many changes, okay? Many changes in terms of where to place the fat, okay? Because before 2017, we were just placing the fat, people would just place the fat anywhere, okay? And there were actually some surgeons at that time saying that it was better to place the fat in the muscle because it has better take, you can get more volumes, and that's when you get these like super dramatic looks in just one surgery, okay? But we've learned from that. We did several cadaver studies. There are several studies out in the literature that said that we shouldn't be putting fat in the muscle, and then these became basically the rules. And actually, by 2019, it became a rule here in Florida, given to us by the Department of Health, that the fat could only be placed in the subcutaneous space. Okay, and if you place the fat deeper to that, you could potentially lose your license. Okay, and so but that didn't only happen in Florida. A lot of the, especially board certified plastic surgeons started doing that throughout the U.S. And the good news is that when there was a follow-up study in 2019, the mortality rate had already come all the way down to about 1 in 14,000, 1 in 14,500, which is great because now this is equal to that of a tummy tuck. Okay, another very common procedure that we do. So that by itself, okay, changing the technique from putting it into the fat to placing it above the fat in the subcutaneous space lowered the mortality rate significantly. Okay, but then came ultrasound, right? And then people like myself, I was one of the early adopters, one of the early people who started using this. Started using it with the ultrasound, and if you take the data of ultrasound guided BBL, okay, and you look at that data, okay, especially today, that takes your mortality rate all the way down to about 1 in 25,000 or less. It may even be less than that. Okay, so it makes this procedure now extremely safe, and that's why currently today, in 2024, it is actually mandated that we use ultrasound for BBLs by law here in Florida. Okay, so it is now a law because the results have been so good in terms of minimizing the mortality rate with this procedure. Okay, so what can I tell you about myself? I've been doing it since 2019. Since then, I've done over 2,000 ultrasound guided BBLs, more than 2,000 ultrasound guided BBLs since September of 2019. Okay, and I've had zero fat embolism. Zero any sort of fat embolism, but zero PFE. Zero PFE. Okay? Alright, so I hope that clears up a few things. One is, why they call laser ultrasound, why you call this ultrasound. Well, there's two different things. One is ultrasound energy versus the ultrasound imaging. Okay? And it also clears up kind of the trajectory, how things have been, evolving with this procedure to now make it a procedure that is actually very, very safe, especially when you use the ultrasound. And like I said, I would never do one without one, and I think really that is the way to go. So it's a law here in Florida, but it's not a law in every state. It's not a law in every country. But I can tell you this: when I went to Colombia to train with the Grand Master there, Dr. Hoyos, who's one of the masters of high definition liposuction, guess what? He does all his gluteal fat transfer with ultrasound as well. So all the people that are really in the know, those that are at the cutting edge with the technology and that really want to keep their patients safe, they're going to use ultrasound for their BBLs. Okay? But enough of me talking. Let's get to some questions.
Okay, this is personal.
Yes.
¿Cómo aprendió español?
Ok. Bueno, gracias por la pregunta. So, yo soy una mezcla. Mi mamá es cubana, mi papá es inglés. So, por eso tengo esa mezcla. Puedo hablar español, pero mi nombre es Earle, que es muy inglés. Ok. Y crecí varios años también en Puerto Rico. So, estuve en Puerto Rico por 5 años, desde séptimo grado hasta acabar high school. Entonces, por todas esas razones, soy totalmente bilingüe.
What's the perfect BMI for a BBL?
The perfect BMI? Alright, so I'm going to tell you this. There's not really such thing as the perfect BMI because say I tell you, oh, I think the perfect BMI is 25. Well, you can have two people with a BMI of 25 and they look completely different, right? Because a BMI takes into account what? Two things, height and weight, right? So it takes height and weight. So you can have differences. So two people can have a BMI of 25 and one can be 6 foot tall and one can be 5 foot tall, right? And they're gonna look completely different. The 6 foot tall person is gonna appear thinner than the 5 foot tall person, okay? So there is no perfect BMI, I would say, but I think we definitely should keep the BMI to less than 30. So the BMI should be less than 30 for the safest results and the best long-lasting results, okay? Now, there's also a limit in terms of how low the BMI can be for a BBL because we're trying to have enough fat for transfer. So I would say that the BMI should be greater. I'm sorry. Anyone caught me on the math there?
Yeah.
All right. So the BMI should be less than 30 and greater than 21. Okay? All right. Less than 30 and greater than 21. Because that's really kind of the ideal range. So I'm not going to say there's an ideal BMI, but there's an ideal range, which is going to be between here and here.
Okay. Third question.
Yeah.
How long should I wait until I have my last child to get lipo 360?
So after you have your last child, you gotta wait at least 6 months, okay? So you wanna wait at least 6 months before undergoing lipo 360 or really any surgery, whether it's a tummy tuck, a lipo 360, a BBL. You wanna wait at least 6 months. And if you're gonna be doing a breast surgery, you gotta wait at least 6 months from when you stop breastfeeding, okay?
How do you determine if tummy tuck is needed?
Great question. So there's a few factors that we look at. One, the skin. Okay? If the skin is loose or of poor quality, then I would recommend a tummy tuck first. So if the skin is kind of hanging over, that means that it's loose. If it has a whole bunch of stretch marks, all right, poor quality, then I recommend tummy tuck first. The second is the muscle. And by muscle, I mean the rectus muscles, which are the abdominal muscles here. So if the muscles are weak, meaning that when you're standing on the side and you relax your belly, it still looks like you're pregnant, okay, then that means that they're weak. So if the muscles are weak, or if the muscles are separated, we call that diastasis. So they're separated, then I would recommend your tummy tuck first, okay? So those are the things that we're looking at. We're looking at the skin and we're looking at the muscle.
Would it make sense to get a BBL if I don't have any children yet?
Sure, we have a lot of patients that get their BBL before they have kids. And a BBL won't really affect you in terms of your pregnancy, so you don't have to worry about it in that sense. And I've had patients where I've done a BBL and then they've had a child, and big if, but if they take care of themselves during the pregnancy, meaning they just don't completely let themselves go, right? They take enough food, of course, to feed themselves and the baby, but not so much food that they're gaining tons of weight, and they stay fairly active during the pregnancy. Then once they have the baby, they tend to bounce back very, very well and still maintain that shape that they had before getting pregnant with the BBL. So definitely BBL is a good procedure to have before you get pregnant if that's what you wish to do. Now the one that I don't think is a great idea, unless you're like a massive weight loss patient or something like that, but it's not, for a tummy tuck it's not really the same thing, right? I wouldn't recommend doing a tummy tuck until you think you're like done having kids, because otherwise you're just going to completely ruin that tummy tuck result, right? The skin's going to stretch out again, the muscles are going to stretch out again, and you're going to end up doing a redo tummy tuck afterwards.
Do you have to stop taking combined pill birth control before surgery?
Yes, definitely. So you want to stop birth control, okay? Over the counter, okay? OCPs at, you want to stop that 30 days before, okay? You want to stop all oral contraceptives at least 30 days before surgery. Two, 30 days after surgery. Okay, so you want to take it before surgery and you can't take it after surgery. Why is that? Because it increases your risk of blood clots. Okay, it can increase the risk of blood clots, and of course that can be dangerous. So we want to make sure that we're decreasing that risk.
Am I able to get arm lipo during a breast reduction procedure?
Yes, so you can get arm lipo during a breast reduction procedure. Okay, here in Florida we have a limit as to how much lipo aspirate or liposuction we can do when you're doing a procedure like the breast, which is 1,000 cc's. But for the most part, people don't have much more than 1,000 cc's on either arm. So it's definitely one of the things that we can add on at the time of the breast procedure is some liposuction or lipodefinition to the arms.
¿La fibrosis puede mejorar con una segunda lipo? Estamos Spanglish hoy.
Sí, hoy vamos para Spanglish. Bueno, es posible, ¿ok? Lo primero que hay que hacer es tratar de prevenir la fibrosis, obviamente, ¿ok? Y eso se previene usando bien la faja y con los masajes. Hay que hacer un mínimo de 20 masajes, quizás más, para tratar de prevenir la fibrosis. Y a veces hay que hacer otras cosas como carboterapia o wood therapy o otras cosas para radiofrecuencia también, para disminuir el riesgo de la fibrosis, ¿ok? Pero bueno, si has probado ya de hacer todo eso, ya ha pasado un año de la cirugía y todavía tienes fibrosis, entonces sí es posible volver al quirófano y tratar de mejorar la fibrosis con el uso de la lipo y lo que hablé la semana pasada, lipo más laser. ¿Ok? Eso es lo que se puede usar para mejorar la fibrosis si ya ha pasado un año desde tu cirugía.
Ok. What about thyroid meds? Is that safe to take before a tummy tuck?
Yeah, definitely. So thyroid meds are one of those medications that you do want to continue taking, okay? So hypothyroidism is actually pretty common out there. I mean, I would say it's not unusual for sure. We have a lot of people or potential patients that are on Synthroid, and it's one of those medications that you definitely need to continue to take kind of throughout your surgery and throughout your recovery.
Does asthma affect surgery?
It can, okay, if it's uncontrolled, okay? So if you have asthma and it's controlled, then that's typically okay. We're okay to go ahead and perform the surgery. But if you're having asthma where you're having like these severe attacks, you're ending up in the ER or in the hospital, and it's not controlled with the proper medication, then no, it would not be a good idea to undergo general anesthesia when your asthma is in that state. You want to get that asthma under control, and once everything is nice and controlled, then is when you can have the surgery. And typically for our asthma patients, we have them bring their their medications with them, their inhalers, in case they need to use them, before, during, or after surgery.
When can I sleep on my side after a tummy tuck?
On your side, okay, so after a tummy tuck, you're going to feel very, very tight, okay? So we're going to recommend you're going to sleep in either a recliner or if you're in a bed with a few pillows behind your back, a couple underneath your knees, okay, to really relieve some of that tension in that belly area. You're going to be sleeping, though, mostly completely face up, all right? For side sleeping after tummy tuck, you're going to want to wait 6 weeks. And then sleeping on your belly, if you're a belly sleeper, you're probably going to wait 3 months after a tummy tuck.
Can you have a BBL after having a miscarriage?
Yeah, it shouldn't affect you. The only thing is you got to make sure that your hormones and everything are back into balance. Okay, so we do check some labs. We check your hormone levels, and once that all comes back down to baseline, then it should be okay.
Okay, could you please do a walkthrough the tummy tuck recovery, like some recommendations on the aftercare?
Okay, so I'll go very briefly today, but we do have. So what my recommendation is that you go to our YouTube channel. All right, so go to YouTube, go to Pure Plastic Surgery on YouTube, and you're gonna find all of these lives up there. Okay, and there's gonna be some that are by, you know, you can see the categories there or the titles of the live. And I've done quite a few on tummy tuck. I've done a comprehensive kind of review of tummy tuck that'll take you in the tummy tuck from like the beginning to the end, including the recovery. So I highly, highly recommend that you go there and you watch that, okay? But in brief, what are some of the things you have to be aware about for recovery after a tummy tuck? All right, number one, remember you're gonna have drains. There are gonna be 2 of them. Okay, so you have to think about your drain care. You're gonna have an abdominal binder initially while those drains are in place. When the drains come out, depending on how quickly you heal, how much fluid is coming out. Once both drains come out, then you're gonna switch from your binder to your faja. Okay, it's very, very important from day 1 that you do your walking. So we recommend you're up and walking at least 10 minutes every hour while awake. And you also use we give everyone here a device for their legs that helps keep the circulation moving and minimize any risk of blood clots there as well. So you're going to have to use that device for the first 2 weeks, pretty much night and day. You take it off only to shower, okay? Stay hydrated, drink about 1 gallon a day, okay? And like I said, you're going to sleep in a recliner or with a few pillows behind your back, a couple underneath your knees to relieve some of the tension in the belly area. It will require massages, not as many as a lipo case, but maybe around 10 or so. And you can start as soon as the next day. The initial massages are going to be more along the flanks and the lower back area.
Can we do one more?
Yeah.
Yes.
Last one?
The last one? Yes.
Last one for today. All right.
Yes, yes. Can you be on blood pressure meds with control blood pressure and be eligible for surgery?
Yes. So the short answer is yes. Once again, it's all about making sure that everything is controlled. So you have hypertension or high blood pressure and it's controlled with a medication, then that's typically okay. Of course, you're going to need a clearance from your primary care doctor. Sometimes we need a clearance from a cardiologist as well. And of course, you have to bring all your medications, make sure you stay on them. Again, those are also some of the medications where we don't stop them. You have to continue those medications to continue to control your blood pressure.
Okay, for all those that ask about consultations, pricing, bookings, and more, one answer for all of them.
All right, one answer for all of them. So pricing, I'm not going to get into that now because honestly it's very complex as every patient is a unique individual and exactly what you want is going to may vary from patient to patient, right? So someone may want a BBL with Vaser, plus minus arms, chain, and whatever. So there's just so many factors there. So the best thing to do is really to reach out to us and so that we can have one of our patient care coordinators give you a call and go over all your information, answer all your questions, go over all your options, etc. Okay? And the easiest way to do that is to first go to our website, okay, which is www.pureplasticsurgery.com, okay? And once you reach the website, right there on the landing page, there will be kind of a squarish type button there that says virtual consultation, a virtual consult, okay? You're gonna hit that button, that's gonna take you to a questionnaire. Fill out the questionnaire, make sure you fill out every single category in the questionnaire so it does go through, okay? And of course you're gonna get to the point where it says procedure. This is where I always get this question, Doc, what if I want more than one procedure? It won't let me put in more than one. Don't worry about it. Don't worry about it, sweetheart, right? Don't worry about it. Just put in the one procedure, that's fine, okay? As long as you're able to fill it out and submit with your photos, it'll come to us, okay? So you fill out the questionnaire, you upload your 3 photos, we need 3 photos minimum. That's gonna come to us, one of our patient care coordinators will then have your information, she's gonna reach out, she's gonna call you, and she's gonna take care of everything that you need. If you want to do more than one procedure, she'll take care of that. She'll talk about, you know, what are the things that we can combine, what we can't combine. She'll answer absolutely every single question you may have. She'll go over pricing, go over the calendar, scheduling, etc., etc., etc. Okay, and they're bilingual, Inglés y Español. All of our patient care coordinators are bilingual. Okay, so that's also very, very important to keep in mind. All right, okay, everybody. Well, I think that wraps it up for today. And I look forward to seeing all of you next week. on Hump Day with Dr. Alex Earle. Ciao.